Discussion.
Helpful topics.
Reaction from people around the world.
Merry Christmas to everyone. So this is Joe Arcaya from Canadian Experience channel. So we'll be sharing information about Pfizer BioNTech COVID-19 vaccine and Moderna COVID-19 vaccine. So these are the two vaccines that are approved by Alberta or Canada or Health Canada. The Pfizer BioNTech COVID-19 vaccine and the Moderna COVID-19 vaccine. So I will be sharing on a fax came from the website itself from the Pfizer BioNTech and the Moderna COVID-19 vaccines. So these are the common or the not common, it's the facts that we should know about these two vaccines. So I'm reading this in the informations I get from the website. If you want to read more information about the vaccines, just go to the www.pfizer.com and for the information of the Pfizer BioNTech COVID-19. So and then you can just go over here when you click this the information about the vaccine, and then you will choose I am not a healthcare professional, then choose Canada, because there are two types of fact sheets that you can read, which is the other one is for the professionals healthcare, and the other one is for the not healthcare professional. So I just want to share this information. I'm going to read this information to you. This is about the Pfizer BioNTech COVID-19 vaccine. So I will be sharing these two information, and the other one is the Moderna COVID-19 vaccine. So let's read the information, the patient's medication information that you should know about this vaccine. So read this for safe and effective use of your medicine. Pfizer BioNTech COVID-19 vaccine, COVID-19 mRNA vaccine suspension for intramuscular injection. Health Canada has authorized the sale of this COVID-19 vaccine under an interim order. This leaflet is a summary and will not tell you everything about this vaccine. So this is only a summary, a backgrounder for the Pfizer BioNTech COVID-19 vaccine. Talk to your healthcare professional about your medical condition and treatment, and ask if there is any new information about Pfizer BioNTech COVID-19 vaccine. What is Pfizer BioNTech COVID-19 vaccine used for? Pfizer BioNTech COVID-19 vaccine is a vaccine used to prevent COVID-19 disease caused by the SARS-CoV-2 virus. Pfizer BioNTech COVID-19 vaccine can be given to people from 16 years of age and older. How does Pfizer BioNTech COVID-19 vaccine work? The vaccine causes our body to produce protection such as antibodies that prevents the COVID-19 virus from entering our cells to make us sick. The vaccine uses a new method, messenger RNA or mRNA, the genetic code for a piece of the virus, to help our bodies make protection against the virus. The vaccine is given by injection with a needle in the upper arm and will require 2 doses given 21 days apart. So you will be given 2 injection and with a given 21 days apart. You cannot get COVID-19 from the vaccine. So that's what they are telling us here. So as with any vaccine, Pfizer BioNTech COVID-19 vaccine may not fully protect all those who received it. So not fully protect all those who receive it. Mark that. Even after you have had both doses of the vaccine, continue to follow the recommendation of local public health officials to prevent spread of COVID-19. So this fact sheets came from the website of the maker of the Pfizer BioNTech COVID-19 vaccine. Okay. What are the ingredients in Pfizer BioNTech COVID-19 vaccine? Medicinal ingredients, mRNA. So that's the medicinal ingredients. The non-medicinal ingredients are ALC-0315. This is a hydroxybutyl, azanidil, hexane 6,1-dil, 2-hexyl decanoate, ALC-0159, 2-disteroyl SN-glycero 3-phosphocholine or choline, cholesterol, basic sodium phosphate dehydrate, basic potassium phosphate, potassium chloride, and sodium chloride. So the first 3 ingredients which shows here, the ALC, those are codes, and those are formulas which are unique. Most of sometimes they are using a code to identify an ingredients of a specific medicine. So these codes are not repeatedly used, so they are unique. These are the identification used by the pharmacists or the doctors to give to the patients. And the last 2 ingredients here are sucrose, water for injection. So those are the ingredients. Pfizer BioNTech COVID-19 vaccine comes in the following dosage forms. So this is the most important that we need to understand. White to off-white suspension to be diluted, provided in a multiple dose vial of 5 doses. After dilution, the vial contain. That's my wife. So we're live now. So after dilution, the vial contains 5 doses of 0.3 ml with 30 micrograms mRNA each. So you should not receive Pfizer BioNTech COVID-19 vaccine if you are allergic to any of the ingredients in this vaccine. So see what are the ingredients in Pfizer BioNTech COVID-19 vaccine. Have any symptoms that could be due to COVID-19? Talk with your healthcare professional about your symptoms and getting a COVID-19 test. Your healthcare professional will advise you when you are able to receive the vaccine. To help avoid side effects and ensure proper use, talk to your healthcare professional before you receive Pfizer BioNTech COVID-19 vaccine. Talk about any health conditions or problems you may have, including if you have had any problems following previous administration of Pfizer BioNTech COVID-19 vaccine, such as an allergic reaction or breathing problems. Have a weakened immune system due to a medicinal condition, or no, not medicinal, or medical condition, or are on a medicine that affects your immune system. And have a bleeding problem, bruise easily, or use blood thinning medication. If you are pregnant, think you may be pregnant or plan to become pregnant, are breastfeeding, or if you're breastfeeding, then you have to tell your healthcare professional or your doctor. Other warnings you should know about. It may take until 7 days after the second dose of Pfizer BioNTech COVID-19 vaccine to develop protection against COVID-19. As with any vaccine, Pfizer BioNTech COVID-19 vaccine may not fully protect all those who receive it. Tell your healthcare professional about all the medicine you take, including any drugs, vitamins, minerals, natural supplements, or alternative medicines. There is no information on the use of Pfizer BioNTech COVID-19 vaccine with other vaccines. Tell your healthcare professional if you have recently received any other vaccines. How Pfizer BioNTech COVID-19 vaccine is given. So these are the doses. Usual dose, Pfizer BioNTech COVID-19 vaccine is given after dilution as an injection of 0.3 ml into a muzzle of your upper arm. You will receive 2 injections, given 21 days apart. It is important that you return for the second injection, or the vaccine may not work as well. So that's the very most important thing. If you got the first vaccine and then you need a follow-up, but if you forgot to follow up, and then it's a waste. So because it's not gonna work if you don't have the second shots. All right, keep that in mind. If you have any further questions on the use of Pfizer BioNTech COVID-19 vaccine, ask your healthcare professional. So this is about the overdose. In the event of suspected overdose with Pfizer BioNTech COVID-19 vaccine, contact your regional poison control center. And if you miss dose, so if you miss the dose, if you forget to go back to your healthcare professional at the scheduled time for your next dose, ask your healthcare professional for advice. What are possible side effects from using Pfizer BioNTech COVID-19 vaccine? Like all vaccine, Pfizer BioNTech COVID-19 vaccine can cause side effects. Side effects may occur at the following frequencies. So very common. These are common cases when you get shots. Like for example, if you get flu shots, there are some side effects. These are common side effects like pain at injection site, tiredness, headache, muscle pain, chills, joint pains, fever. And a uncommon may affect up to like 1 in 100 people. So enlarged lymph nodes. So I think those are severe allergy. These are not possible. So these are not all the possible side effects you may have when taking Pfizer BioNTech COVID-19 vaccine. If you experience any side effects not listed here, tell your healthcare professional. Should you develop any serious symptoms or symptoms that could be an allergic reaction, seek medical attention right away. Symptoms of an allergic reaction include hives or bumps on the skin that are often very itchy, swelling of the face, tongue or throat, difficulty breathing. So if you experience a severe allergic reaction, of course you need to call 911 or go to the nearest hospital. Your healthcare provider should inform your local public health department of any serious side effects after vaccination. Reporting suspected side effects for vaccine for the general public. Should you experience a side effect following immunization, please report it to your healthcare professional. Should you require information related to the management of the side effect, please contact your healthcare professional. The Public Health Agency of Canada, Health Canada, and Pfizer Canada, ULC, cannot provide medical advice. For healthcare professionals, if patients experience side effects following immunization, please complete the adverse events following immunization, or AEFI, the adverse events following immunization form. So it's a kind of form that you need to fill up, or the healthcare professional needs to fill up, for form appropriate for the provinces or your province or territory. So here the storage. So these are the issues that the Health Canada is talking about. The storage of the Pfizer BioNTech COVID-19 vaccine should be stored, supplied, and administered by a healthcare professional. So keep out of reach and sight of children, of course, If you want more information about Pfizer BioNTech COVID-19 vaccine, talk to your healthcare professional. Find a full product monograph that is prepared for healthcare professional and includes this patient medication information by visiting the Health Canada website. So the manufacturer's website is www.pfizer.ca or by calling 1-800-463-6001. Pfizer Medical Information. So this leaflet was prepared by Pfizer Canada ULC. Last revised December 9, 2020. So these are the information that they provided, and I was looking for, I think that's for the professional. They're not, they did not put anything here the temperature that needs to be when you're storing this vaccine, and it's not in here. I think it's on the professional side fact sheets. And then so let's talk about the Moderna vaccine. So if you want to research about the Moderna vaccine, just go to their website. It's www.modernatx.com. So let's read about the information about the Moderna vaccine. Just go to their website and you can download the information about this vaccine, the Moderna COVID-19 vaccine. So you will see the difference about these two vaccines that approved by the Health Canada. So here is the information. Let's read it. Fact sheets for recipient and caregivers emergency use authorization EUA of the Moderna COVID-19 vaccine to prevent coronavirus disease 2019 or COVID-19 in individuals 18 years of age and older. So the difference between the Pfizer BioNTech COVID-19 vaccine and the Moderna COVID-19 vaccine is the Pfizer has 18 years of age and older. So from 16 they use the Pfizer vaccine, and the Moderna vaccine is 18 years of age and older. So that's the difference between the two. So you are being offered the Moderna COVID-19 vaccine to prevent coronavirus disease 2019 or COVID-19 caused by SARS-CoV-2. These fact sheets contain information to help you understand the risk and benefits of the Moderna COVID-19 vaccine, which you may receive because there is currently a pandemic of COVID-19. The Moderna COVID-19 vaccine is a vaccine and may prevent you from getting COVID-19. There is no U.S. Food and Drug Administration approved vaccine to prevent COVID-19. So it's the same statement that the Pfizer and Moderna disseminate on their fact sheets. So there is no approved yet, and you'll be asking why the vaccine was introduced into the public, but it's not approved yet. So, well, the basis that it was approved to be used in the public, but they use the term not approved by, it's not licensed yet. So it's not complete. That's the meaning of it. So their basis is it's not really a full study, but it's the basis of minimum requirements to let this vaccine used for public, because there is a pandemic. So read these fact sheets for information about the Moderna COVID-19 vaccine. Talk to the vaccination provider if you have a question. It is your choice to receive the Moderna COVID-19 vaccine. So it's up to you if you want to receive it or not. So their basis, the reason why these two vaccines, despite there is no complete study yet to approve it by the Food and Drugs, the U.S. Food and Drugs, but there is an evidence, 95% from the Pfizer that healed the COVID, or killed the virus. So the Moderna COVID-19 vaccine is administered as 2-dose series, 1 month apart into the muscle. So the Pfizer has 21 days before you get the second shot. The Moderna COVID-19 is 1 month or 30 days before you can you receive the second dose series. The Moderna COVID-19 vaccine may not protect everyone, same as the statement from the Pfizer. The fact sheet may have been updated. For the most recent fact sheet, please visit www.modernatx.com/COVID-19 vaccine-EUA, or emergency use authorization. So that's the permit, or it is the authorization from the FDA, US FDA, which the reason why these two vaccines was authorized by the government to be used for vaccination. So what is COVID-19? So this is not new. Everyone knows what is COVID-19 now. So let's just read it for recap of this information. COVID-19 is caused by a coronavirus called SARS-CoV-2. SARS-CoV-2. This type of coronavirus has been seen before. You can get COVID-19 through contact with another person who has the virus. It is predominantly a respiratory illness that can affect other organs. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. Symptoms may include fever or chills, coughs, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. So what is the Moderna COVID-19 vaccine? The Moderna COVID-19 vaccine is unapproved. So mark that, huh? And that's what it says here. So Moderna COVID-19 is an approved vaccine that may prevent COVID-19. May prevent COVID-19. There is no FDA approved vaccine to prevent COVID-19. So that's it. So meaning there is no approved vaccine yet that can prevent you from COVID-19. So yeah, and that's what their fact sheets telling about, and also the Pfizer also, and the Moderna. So the FDA has authorized the emergency use of the Moderna COVID-19 vaccine to prevent COVID-19 in individuals 18 years of age and older under an emergency use authorization. That's the EUA. For more information on EUA, see the What is an emergency use authorization section at the end of this fact sheets. So, what should you mention to your vaccination provider before you get the Moderna COVID-19 vaccine? Tell your vaccination provider about all of your medical conditions, including if you have an allergy, have a fever, have a bleeding disorder, or on a blood thinner, or ARC. Oh no, it's not ARC. It's R. It just look like ESC. Are immunocompromised or are on a medicine that affects your immune system, are pregnant or plan to become pregnant, are breastfeeding, have received another COVID-19 vaccine. So those are the informations that you should tell your medical provider or healthcare provider. Who should get the Moderna COVID-19 vaccine? FDA has authorized the emergency use of the Moderna COVID-19 vaccine in individual 18 years of age and older. Who should not get the Moderna COVID-19 vaccine? You should not get the Moderna COVID-19 vaccine if you had a severe allergic reaction after a previous dose of those vaccine. So if you have an allergy of those ingredients that's in the vaccine, and then you can't get the second dose. Had a severe allergic reaction to any ingredients of this vaccine. Yeah, that's what I was talking about. What are the ingredients in the Moderna COVID-19 vaccine? So here are the ingredients of the Moderna. The other one that we mentioned before is from Pfizer. So here is for the Moderna. What are the ingredients in the Moderna COVID-19 vaccine? The Moderna COVID-19 vaccine contains the following ingredients. So messenger ribonucleic acid. So that's what mRNA means. So that's the main ingredients of the vaccine. The messenger ribonucleic acid, or mRNA. The other one's lipids. Those are SM-102 polyethylene glycol, or PEG 2000 dimeristoyl glycerol, or DMG, and cholesterol, and 1,2 thus this steroyl and glycerol 3-phosphocholine or choline. They have the same similar ingredients. Trometamine hydrochloride, acetic acid, sodium acetate, and sucrose. So there's a little bit difference with the two vaccines. How is the Moderna COVID-19 vaccine given? The Moderna COVID-19 vaccine will be given to you as an injection into the muscle. The Moderna COVID-19 vaccination series is 2 doses given 1 month apart. So, has the Moderna COVID-19 vaccine been used before? The Moderna COVID-19 vaccine is an unapproved vaccine in clinical trials. Approximately 15,400 individuals 18 years of age and older have received at least 1 dose of the Moderna COVID-19 vaccine. So, what are the benefits of the Moderna COVID-19 vaccine? Question. In an ongoing clinical trial, the Moderna COVID-19 vaccine has been shown to prevent COVID-19 following 2 doses given 1 month apart. The duration of protection against COVID-19 is currently unknown. So mark that. So because it's it's a short period of time, so it's not complete, and they cannot tell the duration of the protection against COVID-19 once you get the shot. So it's still currently unknown because the study is not complete yet. That's why it's not approved yet. So the introduction this to the public, we don't know, but there are evidence that it cures the COVID-19 from 92 to 95% effective. So what are the risks of the Moderna COVID-19 vaccine? Side effects that have been reported with the Moderna COVID-19 vaccine include injection site reaction, pain, tenderness, and swelling of the lymph nodes in the same arm of the injection, swelling or hardness, and redness. General side effects: fatigue, headache, muscle pain, joint pain, chills, nausea, and vomiting and fever. So same as those are common symptoms. There is a remote chance that the Moderna COVID-19 vaccine could cause a severe allergic reaction. A severe allergic reaction would usually occur within a few minutes to 1 hour after getting a dose of the Moderna COVID-19 vaccine. For this reason, your vaccination provider may ask you to stay at the place where you receive your vaccine for monitoring after vaccination. Signs of a severe allergic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness and weakness. So this may not be all the possible side effects of the Moderna COVID-19 vaccine. Serious and unexpected side effects may occur. The Moderna COVID-19 vaccine is still being studied in clinical trials. So it's still under observation. And because we really need a vaccine, and there are evidence that it helps, and that's why it was given an authorization. Actually, it's not approved, but it was given an authorization to use for public use. Maybe it's a part of a clinical trial. So report vaccine side effects to FDA, CDC, Vaccine Adverse Event Reporting System, or VAERS. The VAERS toll-free number is 1-800-822-7967, or report online to HTTPS this is the website, vaers.hhs.gov/report event.html. So please include Moderna COVID-19 vaccine EUA in the first line of box number 18 of the report form. So in addition, you can report side effects to Moderna TX Inc. at 1866 Moderna or 1866 663 3762. You may also be given an option to enroll in V-Safe, or V-Safe is a new voluntary smartphone-based tool that uses text messaging and web survey to check in with people who have been vaccinated to identify potential side effects after COVID-19 vaccination. And VSafe asks question that helps CDC monitor the safety of COVID-19 vaccine. So VSafe also provides second dose reminders if needed and leave telephone follow-up by CDC if participants report a significant health impact following COVID-19 vaccination. For more information on how to sign up, visit www.cdc.gov/vsafe. What if I decide not to get the Moderna COVID-19 vaccine? It is your choice to receive or not receive the Moderna COVID-19 vaccine. You should decide not to receive it. It will not change your standard medical care. Are other choices available for preventing COVID-19 besides Moderna COVID-19 vaccine? So currently, there is no FDA-approved alternative vaccine available for prevention of COVID-19. Other vaccines to prevent COVID-19 may be available under emergency use authorization. Can I receive the Moderna COVID-19 vaccine with other vaccines? There is no information on the use of the Moderna COVID-19 vaccine with other vaccines. Alright, so what if I am pregnant or breastfeeding? If you're pregnant or breastfeeding, discuss your options with your healthcare provider. That's the best option. Will the Moderna COVID-19 vaccine give me COVID-19? The answer is no. The Moderna COVID-19 vaccine does not contain SARS-CoV-2 and cannot give you COVID-19. So most people are afraid of the vaccines because there are some vaccines that they are using ingredients from the virus to use in the vaccine to fight that virus. But it's not happening on the this two vaccine. So there is no residue from the COVID-19 virus that they use into the ingredients. So it doesn't says here. So that's why if you are hesitant, if this vaccine might give me COVID-19, and their answer is no. The Moderna COVID-19 vaccine does not contain SARS-CoV-2 and cannot give you COVID-19. So keep your vaccination card. When you receive your first dose, you will get a vaccination card to show you when to return for your second dose of the Moderna COVID-19 vaccine. Remember to bring your card when you return. Additional information, if you have questions, visit the website or call telephone number provided below. To access the most recent fact sheets, please scan the QR code provided below. So the telephone number 1-866-663-3762. How can I learn more? Ask the vaccination provider. Visit CDC website. Also, these are linkable. So just go to the Moderna Inc. Homepage, and then you'll see the information there, and you just click those website link. And contact your state or local public health department. Where will my vaccination information be recorded? So the vaccination provider may include your vaccination information in your state, local jurisdictions, immunization information system. So that's this one is from the United States. So here in Canada, just contact Health Canada. So we're gonna look for the information about the Canadian site government. So this information is from the United States. So I just read this information because this is the first-hand information that the Moderna ATX or the Moderna vaccines provided to the public, and this is the best information that we can use because this is what the first-hand information we can get to share to the people or to our subscriber. And it is very important to learn about this vaccine. So what is the countermeasure injury compensation program? So this is an injury compensation program is a federal program, a U.S. federal program that may help pay for costs of medical care and other specific expenses if certain people who have been seriously injured by certain medicines or vaccines, including these vaccines. Generally, a claim must be submitted to the CICP within 1 year from the date of receiving the vaccine. To learn more about this program, visit www.hrsa.gov/CICP. So I think it's like an insurance. This is in the U.S. Maybe if there's something happened to you because of this vaccine, and then you can claim. If you have a claim, then you can just submit it to that website here, or call 1-855-266-2427. So this is what is an emergency use authorization, or EUA. So the United States Food and Drugs Administration, or FDA, has made the Moderna COVID-19 vaccine available under an emergency access mechanism called an EUA. The EUA is supported by a Secretary of Health and Human Services declaration that circumstances exist to justify the emergency use of drugs and biological products during the COVID-19 pandemic. The Moderna COVID-19 vaccine has not undergone the same type of review as an FDA approved or cleared product. So that's what they are clarifying here. Again, let's read it again. The Moderna COVID-19 vaccine has not undergone the same type of review as an FDA approved or cleared product. FDA may issue an EUA when certain criteria are met, which includes that there are no adequate, approved, and available alternatives. In addition, the FDA decision is based on the totality of the scientific evidence available showing that the product may be effective to prevent COVID-19 during the COVID-19 pandemic, and that the known and potential benefits of the product outweigh the known and potential risk of the product. All of these potential benefits of the product outweigh the known and potential risk of the product. So that's what it says here. So all of these criteria must be met to allow for the product to be used during the COVID-19 pandemic. So that's the statement of the Moderna. It sounds like the same as the Pfizer. So the EUA for the Moderna COVID-19 vaccine is in effect for the duration of the COVID-19 EUA declaration justifying emergency use of these products unless terminated or revoked, after which the product may no longer be used. So copyright 2020 Moderna TX Inc. All rights reserved. Patents www.modernatx.com/patents. Revised December 2020 12/2020.
Discussion.
Helpful topics.
Reaction from people around the world.
Here is some information that we can share here. So the difference between the issue of the vaccine, these two vaccine, is the Pfizer requires more intensive care, because the Pfizer, you need to store it on above 90 degrees Fahrenheit, negative, not 90, negative 90 degrees Fahrenheit. But the Moderna COVID-19 vaccine, it says here, it can, let's just gonna read this one. Moderna announces longer shelf line for its COVID-19 vaccine candidate at refrigerated temperature. Vaccine candidate not expected to remain stable at standard refrigerator temperatures of 2 degrees to 8 degrees Celsius or 36 to 46 Fahrenheit. So the other one is negative 90 degrees Fahrenheit, so that's too cold. This is the Moderna shelf life of the vaccine when you put, or when you store this into 36 to 46 Fahrenheit for 30 days up to the previous estimate of 7 days. Shipping and long-term storage condition at standard freezer temperature of negative 20 Celsius or negative 4 Fahrenheit for 6 months. So these are the difference between the two vaccines. The other vaccines, Pfizer needs more colder freezing temperature before you can use, or not before you can use, but the storage of the Pfizer vaccine. Alright, so much for that. This is what I'm sharing to all the subscriber. It's our right to know about the vaccines that we are accepting if you want to accept it. And a clear message here from those two companies, the producer of the Pfizer BioNTech COVID-19 vaccine and the Moderna COVID-19 vaccine. Alright, so please subscribe to my channel, and I'm sharing this information to you. Just go to the Pfizer website and the Moderna website for more informations and update. And we're gonna observe, and let's be part of observing this. This is a good news, of course, right? It's at least there are vaccines that exist that they said may help COVID-19. And yeah, let's give this vaccine a chance, because we don't have a choice. If we don't try, or if we don't use it, and well, this is the only choice we have. At least there are, this is very important for us now. But the question is, not the question, the issue here is, even there's already a vaccine, and then it's not enough for the whole population of the world, and the deaths are still rising in the US and here in Canada and any parts of the world. So even you get the vaccine, and it's not still not safe for everyone, because for example, if I get the vaccine and then I touch the virus, and then the virus is in my hands, and I'm the one that is protected. What if those other people that are not immunized or not vaccinated, so they are vulnerable to the virus? So even if we have this vaccine, and we still need to follow the protocols of COVID-19 that's given to us by the health department. So that's my message. So thank you, and please subscribe to our channel. It's not my channel, it's our channel. Alright, and this is
Discussion.
Helpful topics.
Reaction from people around the world.
Feel good.